Good day, ma'am. I'm Jezebel D. Palingkod, BizCrim first year Alpha. Now I'm going to discuss about the artificial and natural method about contraceptives. Number 1 is the oral contraceptives. The artificial method of using oral contraceptives are using two hormonal methods, the oral contraceptive pills and the Depo-Provera. And in the intrauterine device also have two barriers, the latex condom and the diaphragm. While in the sterilization is tubal ligation and vasectomy. Oral contraceptive is being used by taking one pill for 21 days, 3 weeks in a row. Then, don't take any pills for 7 days, which is the week 4. You'll get your period during the 4th week while you aren't taking any pills. It's important to take every pill in a 21 days pack because there are no reminder for hormone-free pills. The advantage of oral contraceptive is it is safe, simple, and convenient way to prevent pregnancy. It also has other benefits like reducing acne, making your periods lighter and more regular, and easing menstrual cramps. While the disadvantage of oral contraceptives is it also causes temporary side effects at first, such as headaches, nausea, breast tenderness, and mood swings. If these do not go after a few months, it may help to change to a different pill. It can increase your blood pressure. The side effect of it is the most common adverse effect of using contraceptive pills is breakthrough bleeding. Women will also complain of nausea, headaches, abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. While nausea can be avoided by taking the medication at night before sleep. Second, the transdermal patch. The transdermal patch is a safe and convenient birth control method that works really well if you always use it correctly. You wear the patch on certain parts of your body, and it releases hormones through your skin and prevent pregnancy. The and it releases hormones through your skin to prevent pregnancy. The patch has lots of other health benefits too. The transdermal contraceptive patch is being used by a carrier for a drug, holding it until it's applied. At the point of application, the patch adhesive secures it to the skin, and the drugs contained in the patch will begin to permeate into the bloodstream. The advantage of transdermal patch is it has several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Patches can be easily applied by the caregiver, and they provide a visual and the medication has been administered. While the disadvantage of transdermal patch does not provide protection against sexually transmitted infection or the STI, including HIV, it must be prescribed by a healthcare provider. The estrogen levels are higher with the patch than with the other hormonal methods. The side effect of transdermal patch is using transdermal patch is it can increase risk of blood clotting problems, heart attack, stroke, liver cancer, gallbladder disease, and high blood pressure, breakthrough bleeding or spotting, skin irritation too. Third is the vaginal ring. The artificial method of using vaginal ring is also called NovaRing. It is a small, soft, plastic ring that you place inside the vagina. It releases a continuous dose of the hormones estrogen and progestogen into the bloodstream to prevent pregnancy. The vaginal ring is being used as the same of hormonal contraception that works in a similar way to the oral contraceptive pills to prevent pregnancy. It can be a good option for women who find it hard remembering to take a pill every day, who are not comfortable using contraceptive implants or intrauterine devices. The advantage of using vaginal ring is more than 99 effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex when the rings is in a place. Unlike the pill, the ring still works if you have sickness like vomiting or diarrhea. While the disadvantage of vaginal ring is it can make you not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The side effect of vaginal ring is sometimes you can feel discomfort, irritation, nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles, feet, or the fluid retention. Or weight may also occur. Vaginal bleeding between periods may occur, especially during the first few months to use. The fourth is the subdermal implants. The artificial method of using subdermal implants involve the delivery of the steroid progestogen from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at the stable rate, providing contraceptives effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. The subdermal implants is being used by inserted beneath the skin of the upper arm. The implant releases a progestational hormone to prevent sperm from reaching the egg. The implant typically suppresses ovulation as well. You can have a contraceptive implant inserted during a visit to your healthcare provider's office. The advantage of using subdermal implants has a long-term contraceptive action without requiring the user's or provider's attention. Low dose of highly effective contraception without the use of estrogen. And fertility is readily reversible after the removal of implants. The disadvantage of subdermal implants is it may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may not get acne, or your acne might get worse. The fifth is the hormonal injections. The artificial method that being used in hormonal injections is a deep intramuscular injection into the muscle of the arm or buttock to be affected immediately. A doctor or nurse will inject depot into the muscle tissue in your arm or bottom. And for continued contraceptive protection, this should be repeated every 12 to 14 weeks. The advantage of hormonal injection, it lasts either 8 or to 13 weeks. It does not interrupt sex. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day. While the disadvantage of hormonal injection, the periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections. It may not protect you against STIs. There can be a delay up to 1 year before your periods return to normal and you can become pregnant again. The side effect of hormonal injections may include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter, or stop altogether. The number 6 is the intrauterine device or the IUD. The artificial method that being used in intrauterine device or the IUD is it is a small contraceptive devices that are inserted into the uterus to prevent pregnancy. And there are two types available, the copper IUD and the hormonal IUD. It is used by putting the IUD by the doctor. It is a small tube that they'll insert into your vagina. They will remove the tube up through the cervix and into the uterus. Then they'll push the IUD out of the tube and pull the tube. Balik-balik. Strings attached to the IUD will hang 1 to 2 inches into the vagina. The advantage of intrauterine device is it protects against pregnancy for 5 to 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can cause it. There are no hormonal side effects, such as acne, headaches, or breast tenderness. A disadvantage of intrauterine device is the periods may become heavier, just like the other disadvantage of a different kind of contraceptives. Next is the chemical barriers. The artificial method that being used in chemical barriers is used in mechanism. Spermicides are sperm-killing chemicals inserted deep into the vagina, near the cervix, before sex. They are available in foaming tablets, melting or foaming suppositories, melting film, jelly, and cream. Jelly creams and foam from cans can be used on their own, with a diaphragm, or with condoms. It is used to prevent birth pregnancy by blocking sperm. This stops the sperm from reaching an egg. Types of barrier methods include condoms, diaphragms, cervical cups, and the contraceptive sponge. Barrier methods work better when you use them with a spermicide. The advantage of it is condoms protect against pregnancy. Barrier methods are safe to use while breastfeeding. Barrier methods do not use hormones. These methods do not affect the woman's menstrual cycle. Barrier methods cost less than hormonal types of birth control. The disadvantage of it is this method do not prevent pregnancy as well as IUDs or hormonal forms of birth control. Barriers method prevent pregnancy only if you use them every time you have sex. You may have interrupt sex to use some barriers methods of birth control. A woman needs a doctor's prescription to get a diaphragm or cervical cup. Buying the necessary spermidical jelly to use with the cervical cup is difficult. The cervical cup and contraceptive sponge do not work, as well as the doctor barrier methods for women who have delivered a child through the vagina. The cervical cup and diaphragm can't be used by people who are allergic to latex or by women who have toxic shock syndrome. The chemical cup should not be used during the menstrual period. And the side effect of it is the diaphragm and spermicide may cause vaginal burning and irritation from the spermicide. Some people are allergic to spermicide or latex and may have a reaction. Use of a diaphragm and spermicide may increase the risk of urinary tract infection or the UTI. Next is the diaphragm. A diaphragm is a shallow, bendable cup that you put inside your vagina. It covers your cervix during sex to prevent pregnancy. The diaphragm is used with clean hands. Put 2 to 2 cm strips of spermicide on the upper side of the diaphragm. Put your index finger on the top of the diaphragm and squeeze it between the thumb and other fingers. Slide the diaphragm into your vagina upwards. This should ensure that the diaphragm covers your cervix. The advantage of using diaphragm is you only need to use a diaphragm or cup when you want to have sex. You can put it in a convenient time before having sex. Use extra spermicide if you have it in for more than 3 hours. There are usually no serious associated health risks or side effects. A disadvantage of using a diaphragm is it is not as effective as other types of contraception, and it depends on you remembering to use it and using it correctly. It does not provide reliable protection against STIs. it can take time to learn how to use it. The side effect of diaphragm is most young women who use a diaphragm have no problems with it, but possible side effects include from the spermicide, irritation of the vagina and surrounding skin or an allergic reaction, strong odors or vaginal discharge if the diaphragm is left in too long. The artificial method of contraceptive cup is a circular dome made of thin, soft silicone that is inserted into the vagina before sex and covers the cervix so that sperm cannot get into the womb. You need to use spermicide with it. Spermicide comes as gel, creams, foams, and pessaries. The use of cervical cup is just like the chemical barriers. So the advantage of cervical cup is, unlike the diaphragm, the cervical cup protects against pregnancy for 2 days or the 48 hours and for multiple acts of intercourse within the time frame. When placed appropriately, the cervical cup is often not felt by either partner during sexual intercourse. The disadvantage of cervical cup is more difficult for women to learn to insert and remove than the diaphragm. It worn for more than 2 days. You run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reactions to the silicone or spermicide occasionally occur. The side effect of cervical cup is have no problems, but possible side effect may include from the spermicide, irritation of the vagina and the surrounding skin or an allergic reaction, strong odors or vaginal discharge if the cup is left in too long. The artificial method of male condom is it is a thin sheet made of latex or rubber, polyurethane or plastic, or natural membrane that is worn over the erect penis during sex. Latex and polyurethane condoms provide the best protection against many STIs, including HIV. A female condom is a thin plastic pouch that lines the vagina. How to use male condoms? Unroll condom all the way down the penis. After sex, but before pulling out, hold the condom at the base, then pull out while holding the condom in place. Carefully remove the condom and throw it to the trash. Advantage of using male condom is it can reduce the risk of spreading sexually transmitted infections, including the human immunodeficiency virus or the HIV. Condoms are often used to reduce the risk of STIs even when the couple is using another method of birth control, such as pills. Disadvantage of using male condoms. Some couples find that using condoms interrupts sex. To get around this, try to make using a condom part of foreplay. Condoms are very strong but may split or tear if not used properly. If this happens to you, practice putting them on so you get used on using them. The side effect of using male condom is has no problem. There are no side effects. Rarely latex only. The artificial method of using female condom is it is provide the best protection against many STIs, including HIV. A female condom is a thin plastic pouch that lines the vagina. It is held in place by a closed inner ring at the cervix and an outer ring to the opening of the vagina. It provides some protection against STIs. How to use female condoms? Find a comfortable position while holding outside of condom and closed end. Squeeze sides of inner ring together with your thumb and forefinger and insert into vagina. It is similar to inserting a tampon. Using your finger, push inner ring as far up as it will go until it rests against cervix. The advantage of using female condoms help to protect both partners from STIs, including HIV. When used correctly, there are reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. The disadvantage of using female condoms is some couples find that putting in a condom interrupts the sex. To get around this, insert it in advance or try to make doing so a part of foreplay. Female condoms are very strong, but they may split or tear if it is not used properly. The side effect of using female condoms is they are a reliable method of preventing pregnancy. It is a form of contraception you only need to use when you have sex. There are no serious... Balik-balik naman. Surgical method is males need to undergo vasectomy, which is executed through a small incision made on each side of the scrotum. The vas deferens is then tied, cauterized, cut, or plugged to block the passage of the sperm. This procedure is done with local anesthesia, so advise the patient that mild local pain can be felt after the procedure. Advise the patient to use a backup contraceptive method until 2 negative sperm count results are performed, because the sperm could remain viable in the vas deferens for 6 months. There is a 99.5% accuracy rate for vasectomy and has a few complications. The advantage of using surgical method is it's minimally invasive because surgeons don't need to use their hands to directly access the body. Incisions are smaller than with the conventional surgery. You'll recover more quickly. There is less pain and blood loss. You have a smaller chance of infection and threat your condition. The risk of having a surgery is blood loss is a vein or the deep venous thrombosis or the DVT, bleeding or infection, bowel obstruction caused by scar tissue, leakage of fluid, or if opting for glastic banding. Adverse reaction to anesthesia, nausea and vomiting, band slippage if opting or glastic banding, gallstone, overall risk of health. The side effect of surgical method is nausea and vomiting can occur because of the effects of a general anesthetic used during surgery. Medicines are often given to prevent uncontrolled nausea and vomiting. Nausea and vomiting are usually temporary side effects and often go away a few days after surgery. Find out more about nausea and vomiting. The natural method of using abstinence is simply not having sexual intercourse if you're abstinent. It means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. How to use abstinence? Most people, abstinence means not having sex with anyone. Sometimes people use abstinence as birth control to prevent pregnancy. Abstinence prevents pregnancy by keeping semen away from the vagina, so the sperm cells in semen can get to an egg and cause pregnancy. The advantage of using abstinence is it can be a way to avoid the risks that come with sex, like pregnancy STDs, until you're ready to prevent and or handle them. Abstinence can also help and focus on the other things in your life that are important to you, like friends, schools, sports, activities, having fun, and planning for your future. While the disadvantage of using abstinence is people may find it difficult to abstain for long periods of time. Women and men often end their abstinence without being prepared to protect themselves against pregnancy or infection. The side effect of abstinence is when sexual abstinence is involuntary, some individuals may feel negative effects on their mental health. Conversely, people who do not feel sexual desire may find these feelings distressing. Not having sex when in a relationship can make a person feel insecure or anxious. The natural method of calendar method is the calendar rhythm method is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you'll ovulate. This helps you to determine when you're most likely to conceive. How to use calendar method? Calendar method can use to record the length of 6 to 12 of your menstrual cycles, determine the length of your shortest menstrual cycle, determine the length of your longest menstrual cycle, plan sex carefully during fertile days, and update your calculations every month. Advantage of using calendar method is work allow women to avoid sexual intercourse or use alternative contraceptive methods during the fertile stages of their menstrual cycle. Disadvantage of using calendar method is can only predict what are most likely to be safe and unsafe days. It can tell you for sure exactly when you're fertile, so it's hard to use if your cycles are not always the same length, and you can't use it at all if your cycles are shorter than 27 days. The side effect of calendar method is the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle. And even then, it can be hard to be 100% sure what days you're fertile. The natural method of a basal body temperature is take your basal body temperature every morning before getting out of bed. Use a digital oral thermometer or one specifically designed to measure basal body temperature. Make sure you get at least 3 hours of uninterrupted sleep each night to ensure an accurate reading. How to use nasal body temperature? It is used to take your basal body temperature every morning before getting out of bed. Use a digital or thermometer or one specifically designed to measure basal body temperature. Track your temperature readings and plan sex carefully during fertile days. The advantage of using nasal body temperature is it can be used as a way to predict fertility or as a part of a method of contraception by helping you gauge the best days to have or avoid unprotected sex. Tracking your basal temperature for either fertility or contraception is inexpensive and doesn't have any side effects. This disadvantage of using the body nasal temperature is the basal body temperature method may not accurately predict ovulation in all women, including those with irregular menstrual cycles. It offers no protection from sexually transmitted diseases. The side effect of the nasal body temperature is tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Some women may choose to use the basal body temperature method for religious reasons. The basal body temperature method can also be used to detect pregnancy. The natural method of cervical is also called a Billings ovulation method. The cervical mucus method is based on careful observation of mucus patterns during your menstrual cycle. Before ovulation, cervical creations change, creating an environment that helps sperm travel through the cervix, uterus, and fallopian tubes to the egg. How to use cervical mucus method? It is used to record your cervical secretions for several cycles. Starting the day after your menstrual bleeding stops, observe and record your cervical secretions on a daily chart, either on paper or with an app designed to track fertility signs. The advantage of using cervical method is it is a way to identify fertile times to help you gauge the best days to have avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reasons. A disadvantage of using cervical method is the drawbacks cervical mucus method. The cervical mucus method does not protect against sexual transmitted diseases. Also, several factors can change the look and feel of cervical mucus. These changes may make it difficult to evaluate the mucus to predict ovulation and prevent pregnancy. Natural method of symptothermal method is a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. The use of symptothermal method is you take your temperature in the morning every day before you get out of bed. The cervical mucus method, you check your cervical mucus vagina discharge every day. You chart your menstrual cycle on a calendar. The advantage of using symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares the same disadvantage that each of these techniques has individually. The disadvantage of symptothermal method is that intercourse must be restricted to only 7 to 13 days of the cycle. Women must take care temperature daily. The method cannot be used during fever episodes, and the method is inappropriate for use during lactation or near menopause. The side effect of symptothermal method is both these methods are associated with side effects, particularly in combination with other medications, and tobacco and health complications including mood changes, acne, headaches, breast tenderness, pelvic pain, excessive bleeding, amenorrhea, nausea, weight gain, and uncommonly blood clots. Natural method of using ovulation is it's also called Abelian's ovulation method. The cervical mucus method is based on the useful observation of mucus patterns during your menstrual cycle. The proper use of ovulation is you can urinate on the test stick or urinate in a cup and place the stick in the urine. Results are usually available in about 5 minutes. Ovulation test kits have two lines. One is a control line that signals the test is working properly, while the other one is a test line. The advantage of using ovulation is it detects a surge in LH. It helps predict when you will ovulate. Knowing this information helps you and your partner time sex for pregnancy. The disadvantage of using ovulation is limited detection. Ovulation tests detect LH levels, but they don't give you an exact date of ovulation. Eggs may not emerge even after an LH surge. A side effect of ovulation detection is mild pelvic or lower abdominal pain. Cold metal skirms. Ovulation pain can feel like a sharp or dull cramp at the side of your abdomen where the ovary is releasing the egg. This ovulation side effect can last anywhere between a few minutes and a few hours. The natural method of coitus interruptus is also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. How to use coitus interruptus? Coitus interruptus, also known as withdrawal, is a traditional family planning, just like what I said. And the advantage of using coitus interruptus is some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or used as backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated with health risk. The disadvantage of using coitus interruptus is it doesn't offer protection from sexually transmitted infections. Some couples also feel that the withdrawal method disrupts sexual pleasure. The withdrawal method isn't as effective at preventing pregnancy as other forms of birth control. The side effect of coitus interruptus is withdrawal as a contraceptive technique does not make sure of artificial devices. However, it does have several disadvantages. Men discharge a small amount of semen before ejaculation. Second, men withdraw their penis late and assimilate the female. Third, side effects include loss of sexual. And that's all. Thank you.